Hi, we're back. This is part two of psychological awareness. And again, my name is Kelly Morris. And this video, part two, is going to focus on common stress reactions in the event of an emergency or disaster, and how you can identify how you typically respond to anxiety and stress, and what to be aware of if it becomes extreme. Those coping mechanisms that maybe we can increase so you don't have any long-lasting adverse effects of having to deal with reactions and situations in the event of an emergency or disaster. So during the extended care is what is going to be defined as having your clients in the day treatment program longer than the typical treatment day, whether it's 8 to 3, 3:30, 4, that there may be a reason that you would stay longer, anywhere from 3 hours to 24 hours or even longer. How there are typical stress reactions that you need to be aware of, and what may be a little more adverse for you. So the first slide says common stress reactions. These are very common that most of us, if not all of us, experience during a stressful event or environment, a situation. There are a number of common responses when working with people in a stressful environment. And these have to do about you, not necessarily about how the clients are reacting, but how you are being affected. So keep in mind when we're talking about this, how this would be directed to you. So there's an increase or decrease in activity. And that means like an adrenaline rush. And then now I'm running around and I'm not realizing that I've been doing this nonstop for 6 hours. And a lot of that is the adrenaline rush, like I said just now, as far as when we are in a milder state of panic or anxiety. Something has disrupted the day, and now I'm keenly aware of how are we adjusting to this. The logistics of who's here, who's doing what, where am I supposed to be, what am I supposed to be doing, and who's asking it of me. And where are the clients? How are they responding? Who are they reacting to, responding to? And how am I coping in this situation? There may be a decrease in activity. Maybe we're just kind of sitting around staring at each other. And my mind is racing because I don't know what's happening next. I need to get up and do something. Or one of my coping mechanisms is to stop doing things. I just kind of retreated somewhere because I'm not ready for what's happening right now. You may have sleeping difficulties. Maybe you did stay for maybe 6 hours longer. That in itself can be disruptive to your sleep because not only is your sleep cycle or schedule interrupted, but lots of things are running through your head. What happened that day? What were the events that happened? What sticks out in your mind? What you wish you would have done differently or didn't do? Or who said what to who? All those things that race through your mind as you're laying there trying to go to sleep. So it may be difficult to get to sleep and stay asleep. There may be substance use. Think about you and how you cope. Many people at the end of a day go home and think, well, I'm going to have myself a beer with my dinner and just relax. And then there are those who do this to self-medicate. I'm going to have a couple glasses of wine because this was a really stressful day. And this isn't typically how you would normally enjoy a glass of wine. Now you're doing it to self-medicate because the day stressed me out. I'm still feeling anxious and kind of traumatized by what I experienced, what I saw, what I had to deal with. Are you using anything else? Be very honest with yourself. We all find coping mechanisms and self-medicating behaviors, including substance use, that is actually an adverse effect, has an adverse effect, because we may be medicated for a little while, but once we come down off of that, those situations and the stress and the memories are still there. So it doesn't make it go away, it actually makes it worse. Numbing. We kind of become numb to emotions because our system is in a state of shock. So I'm numb to, what am I feeling? I don't really know what I'm feeling. That's kind of an odd feeling, kind of out of yourself. I actually don't want to feel anything. I don't want anyone to ask anything of me. I don't want anyone to ask one more thing of me. I'm numb. I'm overwhelmed. My system emotionally and mentally is kind of clocking out. Or you may respond differently. I'm much more irritated, and irritated all the time, it seems, lately, since whatever happened. I'm angry a lot, and I don't know why. Frustrated and snappy at those that are around me. I'm not as calm with my clients. And again, being a mother of a son who attends a day treatment program, our fear is that our child is not being cared for the best way that they can be. That we may have children and loved ones who have challenges of their own, who can be challenging to take care of. And yes, you do your job well, but if you're already in a stressful state, you may not have that ability to be as calm or as direct or as effective as you did before. You may react to your clients, and that is not healthy for you, and it's certainly not healthy and safe for the clients. So think about a time when, whether something happened at home or there was a situation with a client where it just got to be too much. There was really nothing you could do. He or she was just having a rough day, but it wiped you out. Think about how you felt before, during, and after. Go through a mental evaluation of how did I respond to that. I'm sure all of you can come up with a day. There was a certain incident where, yeah, I didn't handle that very well. I snapped at the client, or I snapped at one of my coworkers, or it built and built and built, and I went home and I lost it. That was rough. We all have those days, but when it is increased or exacerbated by an emergency or disaster, that can become even worse. So be aware of what triggers you the most. If you don't like constant noise, or if you have a certain coworker that you just don't get along with, or because of the emergency state, people kind of go into zones of hypervigilance, or someone decides they're going to be the boss now, or the boss just kind of disappears, realistically or emotionally. How you respond to that, to cope the best way you can, because you have no control over someone else's behavior. You only have control over yours. And the better you cope with your reactions and behavior will have a direct effect on how calm everyone else will be around you. And that's not to say you're responsible to care for the others, because you will be, as far as your peers. They should be responsible for themselves. And if they're having a hard time, you have to deal with them having a hard time too. And again, think about those situations where someone else maybe did not respond well during a situation at the DTA, and how you perceived that, how you go look at their reactions and think they did not handle that very well, and the client did not handle that very well. Those are scenarios to return to and think about what I could have done better, or how I could have coped better. Hopefully these things you can apply to that. Some more common stress reactions are, it's called vicarious traumatization, in the form of shock, fearfulness, horror, helplessness. And what that means by vicarious traumatization is you are traumatized by someone else's trauma. You see something happen. And these are extreme situations. I'm sure we've watched things on TV where witnessing that, it didn't happen to you directly, but you saw it happen to someone, and that had a direct effect on you. So that's what vicarious traumatization means. I felt very helpless. I couldn't stop the pain for someone. I couldn't stop the situation, and that traumatized me. The next one, confusion, lack of attention, and difficulty making decisions. That's another part of being traumatized, is I don't know what to think of first. I don't know what I'm supposed to do now. I walked into this room and I don't know why I'm here. I have to do 3-step situation and I can't remember if I did the first 2. Those are reactions to stress and how well you are coping, and or maybe not coping so well. Your physical reactions. Are you getting headaches? Do you have headaches? Maybe you get migraines. Now you're feeling a migraine coming on and you're at the program. How do you deal with that? Stomach aches, nausea. Typically that comes with anxiety because our bodies have now released adrenaline or whatever of the millions of chemicals we have in our body that now we're nauseous. We're nauseous because of the fear. Again, that's a chemical reaction. And maybe you haven't eaten, you don't feel like eating. That's a direct effect, stress effect. Being easily startled. And when you're dealing with clients who, they may be vocal anyway, that may be their way of communicating. You have those who, with their challenges becomes, there are some that cry out nonstop. They may repeat words over and over and over again all day long. That's just who they are. But today, because of everything I'm going on, I can't handle that. It's becoming overwhelming. Those things that are, because your resilience has now been limited. Your stress level is being strained. Some more extreme reactions is compassion stress. And this one is very important for you to be aware of because this is part of your job. And as a mother, again, I want to know that my son is cared for, not just physically, but emotionally, that someone cares about him. He is acutely aware of if someone is uncomfortable with him, he is stressed. He will act out. He will shut down. Because he's keenly attuned to someone's level of comfort with him. He's not comfortable around people who are loud, people who move a lot. It gets overwhelming to him. He needs calm, he needs relaxed, and when a situation like this disrupts that security for him, he then responds. And you just think about yourself. We all do that to some level. Of this is me. I'm a calm person. I have other people that I love in my life that they never stop. That exhausts me. I'm more calm. I need things quiet. I don't like a lot of noise. I don't play music while I work. Whatever it is, now that's been disrupted and I'm having a difficult time focusing, staying calm, caring for someone else, and now I'm tired of it. This individual will not stop crying because they thought they were going to go home an hour ago, and all they want to do is bolt out the door, get on the van. They want to go home. They keep telling me they want to go home. I can't redirect them because they know this isn't going to happen right now. So they are in a heightened state of stress and panic themselves. And I don't feel like doing this anymore. I would love to get on the van too and just take off. that is directly affected, that compassion stress. I do this for a job, and this is the job that I have chosen, but I know that I can look forward to 4:30, 5 o'clock and go home and then decompress. If you're in a situation where that's not going to happen for quite a while, you are set now in a state of anxiety and stress and irritation, and your clients feel it. And we get to the point, I know even as a mother, as much as I love my son, there are days where I just am not in it today. I just want to not have to change a diaper today. I just want to not have to deal with fixing 3 meals a day or whatever it is, that we all experience that. And now you're in a situation where it is required on another level of what you've already put in, and thank you very much for doing that every day. Now you can't just clock out and go home. And I'm tired of doing this. So think about those times where that may happen for you. You may feel helpless. You first may be stressed because I can't communicate to this person that they can't go home right now. That your parent or loved one is not going to come pick you up at 4 like they always do. And I'm irritated at having to repeat myself or trying to redirect their behavior. And I'm feeling helpless because I care for this person and I can't calm them, I can't soothe them, I can't convince them that they're going to be taken care of. Then I feel helpless. I feel helpless for what's going on outside. I don't even know how things are going out there. I'm helpless with how is my family doing. I don't even know how they're doing. I'm stuck here in the DTA and I can't take the time to make a phone call to make sure they're okay. I'm feeling very helpless, very stressed. I'm confused because now I don't know what to do next. I'm used to, okay, we've wound up the end of the day, everyone's gone home, I've cleaned up all the areas in the facility, and now I'm not sure what to do. We have a routine from 8 to 5, and that routine has now been extended. I don't know what to do next. I'm confused. I'm confused and I'm irritated because now the managers aren't really sure because they're confused and unsure and stressed. Compassion fatigue also leaves you feeling demoralized, where that means this just doesn't do any good. It's not going to do any good. They're just going to keep crying and crying and crying, and I'm no good at this. I'm feeling demoralized. I'm feeling like this is never going to end. I'm never going to get home. All those extreme words, never, always, no one, everyone. And the more we say that to ourselves, the more we stress ourselves out even more. So think about what demoralizing reactions are for you. The next one is alienation. I'm beginning to alienate myself from maybe other coworkers, or I'm emotionally alienating myself. I'm kind of shutting down, and your clients feel it, and your peers may see it. You're not making eye contact. You're keeping busy in a certain area of the facility, and you are not connecting with your own emotion. That's emotionally alienating yourself, or physically alienating yourself. Or if you get home, you're able to get home, and now I'm alienating myself from my family. I'm just stuck in my room and watching Netflix for hours and hours because I am overwhelmed and I'm not coping very well. I'm alienating myself. Resignation. Resignation is kind of like another way of saying I'm giving up. I'm just giving up. I'm doing no good. Nothing's going to change. It's kind of an upgrade from demoralization. And that's kind of a dangerous place to get because you begin to feel apathy. I don't feel anything. I don't care whether they're crying or not. I don't care whether they need a diaper change or not. I don't care whether they're hungry or need a drink of water. I'm done. I can't do one more thing. That's a dangerous place to be. There's more extreme stress reactions, and I don't mean for all this to be Debbie Downer, but these are things we really need to be aware of how, what could be unexpected, and how to be a little more prepared if something does happen, so you can go back and go, oh yeah, I thought about those, and I know how I typically react and respond in what you would consider normal stressful situations, and I'm a little more prepared. So we're going to continue talking about extreme stress reactions. So the next slide, extreme stress reactions, continued with the little SOS island. So there may be attempts to over-control in a professional or personal situation. Maybe you because your state of fear or panic or stress, you start kind of taking over, and you become you take over a role that either was not given to you, or you feel you have to do it because in your mind everyone else is not doing it right. Or you feel like I'm panicked, and the more I get done, that means the closer I can get to going home. So we kind of take over and over control, and you know what it feels like when someone tries to control you. There's a difference between being professional and understanding who's the manager, and those positions at work of who is the DTA manager, and they tell us who manages this group over here or who takes care of transportation. That's very different as far as who is in management and who is overly controlling. Or someone just kind of leaves. No, there's no one in control, and you're used to, look, just tell me what to do and I'll do it. This is my role. I am not a supervisor. I am not a manager. I'm here to care for this specific group or this specific individual. And now someone is kind of taking over, or you are taking over for somebody else. That increases the stress level around everyone, because now everyone's going to become defensive or argumentative or loud, and confusion just escalates even more in an already confusing situation. You withdraw and isolate, or someone else, maybe your other coworkers withdraw and isolate. So now you have to pick up because they're not coping well. And someone has to change that diaper or fix that meal or clean up that mess, whatever it is, because maybe Joe or Mary bolted. They left. I don't know where they went. Now I have to do all the work, or more of the work. We kind of talked about that earlier as far as the fatigued, where you alienate yourself. This is different in a way of you withdraw and isolate while you're at work. It may be a short-term coping mechanism to in the moment, but it then makes the rest of the environment confused even more, because now you've disappeared somewhere. Someone else has disappeared. I don't know where they went. The next one, preventing feelings by relying on substances, over preoccupation with work, or drastic changes in sleep. And this is kind of a stepped up level of stress from what we talked about before. You may be doing this at work. Maybe you had stuff in your locker or your purse or your wallet, and now you're using substance at work because you are not coping well. Or you become so over-occupied with a specific task because what you're doing is, I'm avoiding the situation. So I'm just going to focus on washing these dishes over and over and over again. Or I'm going to go fold towels when they not necessarily need to be folded. That's not anything that needs to be done right now. But I'm so consumed with this because I don't want to think about what else is going on out there. In clinical sense, it's kind of a form of what we call dissociating. I'm dissociating myself from the situation because I don't want to feel it. It scares me, it panics me, I feel helpless. And so what I'm going to do over here is I'm just going to Do an art project in the midst of an emergency or disaster. Those are various examples of preoccupation with something. And drastic changes in sleep. If you're able to go home and then it's been days since you've been able to sleep, or that's all you want to do is sleep. I can't get out of bed. I wake up and all I can think about is just crawling back into bed. Those are also symptoms of depression, and we'll get into that in a little while. And more extreme reactions. The serious difficulties in interpersonal relationships. If something has happened that you've experienced and you go home and have not dealt with the stress, and you've already, like we talked about in the first video, there have been some stressors at home already. You get home and you are not coping well, your partner is not coping well, or family member, whomever is there is not coping well, and it can get emotionally or physically abusive because you're not coping well. That is an extreme reaction to the trauma you experienced. You take unnecessary risks. I'm just going to get up in the middle of the night and drive down the freeway. I just need to feel like I'm getting away. That's not normally something I do. Or, I'm just going to go and drink a 24-pack. That's unnecessary risk taking because you are avoiding the fear, the pain, and you're putting yourself in a very dangerous situation. And then, like I mentioned just a few minutes ago, depression accompanied by hopelessness. You need to be aware of, there's a difference between clinical anxiety and depression and situational anxiety and depression. Clinical it's a chemical imbalance. You see commercials about that all the time for the medications. Those are situations to where we have no control of what our brain decides to produce, what chemicals, serotonin or adrenaline or whatever. It just decides, because there is no perfect body system, that's what our normal is. So depression is too much of dopamine. ADHD, there could be a chemical imbalance with that. Whatever it is, there's medications that we take to help balance that out. And the situational depression is the situation. A death in the family, a loss of job, financial situations. That's depressing. That's different from the clinical part. But one has a direct effect on the other. So if you're already maintaining your self-care, if you have a mood disorder like depression or bipolar disorder or things like that, good for you. Great that you're caring for yourself and staying on top of that. Just like having high blood pressure or diabetes, excuse me, or asthma, you're taking care of yourself, taking the directed medications, and doing all the healthy things you need to do to keep yourself in balance. But if you're not doing that, or your depression gets triggered, your bipolar gets triggered by an event, you need to be aware of, how am I going to care for myself more effectively? Because if hopelessness sets in, that's very dangerous. Kind of like earlier when we talked about resignation. Because resignation is, I've just resigned that nothing's going to change. It's not going to get better. The hopelessness, that's a part of the depression we need to be very aware of if you have a mood disorder or diagnosis, mental health diagnosis, because that puts you at a higher risk for suicide because of the reaction to both the situation and the internal effect, the psychological effect, the chemical balance effect from this trauma. Be very careful. Be very aware of your self-care. that's the end of the second presentation, and I'll be back for the third. Bye.